All right, let's dive right in. Today, we're talking about one of the biggest challenges in modern medicine, sepsis. It's a silent killer that stalks hospital hallways, and winning the fight against it means winning a race against the clock. But now, a powerful new ally has entered the ring, artificial intelligence.
To really get why this is such an urgent problem, you just have to look at this number. For a patient with sepsis, if their blood pressure drops, their chance of survival falls by 7.6% for every single hour that the right treatment is delayed. This isn't just a challenge, it's literally a race against time where every minute is critical.
So, before we can even get to the new tech solutions, we've got to wrap our heads around the problem itself. What is sepsis really? And what makes it so incredibly dangerous?
Well, the modern definition tells us something that's kind of counterintuitive. Sepsis isn't the infection itself. It's the body's own chaotic, out-of-control response to the infection. Your immune system, which is supposed to be your greatest defender, basically goes rogue and starts attacking your own tissues and organs.
Here's a really great way to picture it. Think of your immune system as a fire department rushing to a fire. With sepsis, that fire department doesn't just put out the blaze. It goes completely nuts, blasting holes in the walls, flooding the floors, and tearing down the building it was meant to save. That's sepsis. It's self-destruction on a massive scale.
And where did these fires even start? Well, you might be surprised. As you can see here, sepsis can spring from some very common infections. Almost half the time, it's from a respiratory infection, like pneumonia. Another big chunk comes from urinary tract infections. And this shows you just how sneaky this threat is. It's not some rare disease. It can start with something that seems totally manageable.
Okay, so you've got this killer on the loose. The clock is ticking. How do doctors actually fight back on the hospital floor? Right now, well, there's a very clear, methodical protocol designed for exactly this kind of emergency.
It's called the Sepsis Treatment Bundle, and it's the go-to playbook. First, they collect cultures to figure out exactly what bug they're dealing with. But, and this is key, they don't wait for the results. They immediately hit the patient with powerful broad-spectrum antibiotics to start fighting whatever might be there. At the same time, they're pushing fluids to keep blood pressure up, and if that doesn't work, they bring in heavy-hitting drugs called vasopressors. It's an established, but incredibly intense and manual process.
And this is where things start to get really interesting. This is where our new ally comes into the picture. AI is now being used as a kind of digital early warning system. These algorithms can sift through mountains of patient data in real time, looking for those super subtle clues that a human might miss until things get much, much worse.
And if you want to see the difference this makes, this chart says it all. This compares a traditional scoring method doctors use, called SOFA, with an AI model. The accuracy score for the old method is around 0.63. For the AI, a jaw-dropping 0.94. That's not just a little better, that is a complete game changer in terms of seeing what's coming.
So what does that incredible accuracy actually mean for patients? Well, it means a huge increase in early detections. We're talking 21 to 32% more cases caught early compared to a doctor's assessment alone. And remember that clock? Getting that kind of head start is everything. It's more time to save a life.
Okay, so if this tech is so amazing, why isn't it in every hospital in the country right now? Well, that brings us to a really big hurdle in the world of medical AI. It's what everyone calls the black box problem. This quote just nails the issue. Many of these powerful AI tools are proprietary. So for a doctor, the system might flash an alert that says, your patient is at high risk for sepsis. But when the doctor asks, why? What did you see? The machine can't really tell them. It's a black box, and that makes it really, really hard to trust.
And the challenges don't stop there. You've got FDA regulations that often require these AI models to be locked, meaning they can't learn and adapt to the specific patients in a new hospital, so its accuracy can actually get worse over time. You add that to the fact that the inner workings are secret and that it costs a ton of money to implement, and you can see why adoption is so tricky.
And it all comes down to this one simple concept: the trust gap. Doctors are trained to understand the why behind everything. If a tool gives them an answer but no explanation, and they can't verify that it actually fits their specific patient, they are going to be hesitant to use it. And honestly, you can't blame them.
So what's the path forward? Where do we go from here?
Well, it's not about having AI replace doctors. Not at all. The future is all about building a real working partnership between human expertise and machine intelligence.
This quote from researchers sums it up perfectly. The answer isn't just a better algorithm, or a better drug, or better training. To finally get a handle on sepsis, you have to bring all of it together. The lab science, the clinical practice, and the computer models into one unified strategy.
And that really brings us to the key takeaway of this whole story. Think about a chess-playing AI. It can see the board, and it can tell you the absolute best move to make to win the game. In medicine, AI is getting incredible at seeing the board. It can spot the danger of sepsis far earlier than we ever could. But, unlike in chess, it doesn't know the best next move yet. That still takes a doctor.
So we're left with this big, fascinating question. We've built a technology that can spot the killer before it strikes, but it can't tell us how to win the fight on its own. So the real challenge now is, how do we build the trust and the transparency to turn this from a cool piece of tech into a true life-saving partnership in the hospital room? Answering that is going to shape the future of medicine.